है मेरी ज़मीं अफसोस नहीं जो तेरे लिए सा दर्द सहे, महफूज रहे तेरी आन सदा चाहे जान मेरी ये रहे ना रहे। मेरी ज़मीं महबूब मेरी, मेरी नस नस में तेरा इश्क बहे, फीका ना पड़े कभी रंग तेरा जिस्मों से निकल के खून कहे।
Good morning, I'm Manshi Joshi, a student of Army Public School, Meerut, Kant. Today I'm online with two more students of our school, Ms. Ritika Khetwal and Master Himanshu Negi. Together, we have the good fortune of interviewing two distinguished doctors. Dr. Sandeep Garg, a consultant nephrologist, dialysis expert and renal transplant physician. He is also the founder of Newtema Hospital, Meerut. Dr. Priyanka Chaudhary, MBBS UCMC, worked as junior resident in Ram Manohar Lohia Hospital, New Delhi, in the Department of Gastroenterology. Even her family have many doctors. For instance, her sister is an eye specialist, her aunt senior orthodontic surgeon, and uncle an alumni of LLRM Medical College.
Both the doctors have been working relentlessly to provide relief to their numerous patients in this difficult time of COVID pandemic, which makes their work even more challenging.
Our purpose today is to try and understand what motivated these distinguished guests to opt for this profession, as well as to express our gratitude to them and through them to the entire medical fraternity of India and the world for being the saviors of the world in the dreaded 2020.
So, being a doctor was a choice since childhood, or your interest developed towards the end of school?
Hello dear friends, myself Dr. Sandeep Garg. I am a nephrologist, dialysis expert and renal transplant physician, and I am now working for last 15 years in Meerut as a transplant physician and nephrologist. And initially when I start my studies, I shouldn't say that I was not good, but I was, say, above average in my studies, and I was used to come say second or third in my class, and there was no as such aspiration as far as my career is concerned. But when I came in class 8th or 9th, people had started asking me that what I want to become after completing my schooling. So at that time, since my father was in army, so I wanted to become an army officer, but unfortunately I was negated by the people because I failed in a medical examination because of my flat foot. And that time I was really in fix what to do, because I didn't study much except for my preparation for NDA during my schooling. So since my sister, who is now heading a prestigious school in Meerut, was pursuing medical at that time, so I did same, and I went to Delhi after doing my 12th and was pursuing first year BSc Honours at a prestigious college in Delhi, and then I got selected. I got a good rank. It was 121 All India rank, and I was fortunate to get Motilal Nehru Medical College as an MBBS graduate. That's all, my friends. Thank you.
I loved science, especially biology. Since I had many doctors in my family, so I had a natural inclination towards medicine. And my interest developed all the more when I studied human biology in class 11th and 12th.
Who was your inspiration? What or who motivated you to join medical profession?
Well, my sister did inspire me to become a doctor, but the charisma behind this profession is the major inspiration to become a doctor. Well, as you all know that besides serving the humanity, you can definitely earn out of this profession, and you can be a center of attraction among the society. Since if you are a successful doctor, definitely people praise you, people like to be friend with you, and you definitely have a good positioning in the society. So beside earning, it definitely gives you respect and admire from your loving ones and society. So these all basically inspired me to become a doctor, and now I really feel proud that I am serving the society for the last 15 years at Meerut, and serving the humanity, especially in the field of nephrology and renal transplant.
There have been many renowned doctors from India, like Dr. Devi Prasad Shetty, Dr. Naresh Trihan, but I was all the more inspired by the lady doctors in my family and in my vicinity.
What qualities or temperament helps in dealing with the challenges of this field?
Well, there are no specific qualities or temperament required to become a good, successful doctor, but definitely you have to be having good communication skills, because doing the professionally acclaimed things, doing our profession is not a very difficult task, but making people understand that we are doing this for your good is very difficult. I usually take around 1.5 hours to 2 hours in my daily rounds, but in this I have to spend at least 80% of time for explaining the thing and explaining the prognosis of the patient, and what sort of procedure we want to do on their patient. And good communication skill definitely is a leverage to become a successful doctor. And as far as temperament is concerned, you have to keep your cool, because because patient and the relative definitely curse you when the patient doesn't do good, and it happens many a times that most of the patient definitely recovers, but few patient definitely succumb to their illness because of irreversible disease process. And this is a very difficult thing, that you explain the relative of the patient that your patient might die. So you definitely require a cool, so that you don't lose your cool. And as far as communication skills is concerned, it needs to be definitely good. So two things, keeping a cool and good communication skill, are definitely required to become a good doctor.
What valuable tips would you like to give to the youth aspiring to be doctors?
Well, becoming a successful doctor definitely needs few qualities. Like, you have to be a good communication skill. You have to have diligence, because intelligence definitely required to become a doctor, but diligence definitely scores over intelligence as far as medical profession is concerned. And you have to be hardworking. You have to be disciplined, because as far as life of a patient is concerned, if you don't follow the protocols, definitely you will fail to treat your patients. So you need to be hardworking, you need to be diligent, you need to be having good communication skill, and you need to be up to date as far as knowledge is concerned. And you need not to be excel in all these fields. Even a good mediocre can definitely excel as far as medical profession is concerned. So diligence is required over intelligence. Hard work is required over intelligence, and good communication skill definitely helps you to become a good doctor.
Work hard. There is no shortcut to success. Do not give up till you achieve your goals.
What challenges do you face while treating COVID patients in comparison to patients of other communicable disease?
Well, as far as COVID is concerned, it's totally a different disease altogether. It seems, because if you see the results in America as well as in Europe, it's quite alarming, because too much of deaths are occurring over there. Well, we are fortunate to have less of deaths and good recovery rate as far as India is concerned, but still we need to have a universal mask usage, especially N95 if we are working in a healthcare system. We need to have social distancing. We need to wear personal protection equipment, that is PPE kit, to avoid this contagious disease among us as well as other healthcare professionals which were involved in the treatment of these patients. We have a few COVID hospitals in Meerut, those who are working round the clock to help these COVID patients. And to treat these COVID patients, we need to wear PPE kit and N95 mask, need to have social distancing, and we have take a few drugs like ivermectin or HCQS as a prophylaxis, so that if we have some exposure to these patients, we don't get the disease. So it's definitely more contagious as compared to other communicable diseases, and more harmful and more dreaded, because if you get it, the chance of mortality as well as morbidity is quite high.
COVID-19 is a communicable disease and is highly infectious. It can lead to lifelong disability and can be fatal as well. There is a need to take strict precautions against COVID-19, not just by self, for others, but by others as well. So there is a need to educate masses about the precautions to be taken against COVID-19 and adapt to the new normal.
How do you protect yourself and your family members? What safety routine do you follow?
Well, as far as protection from this contagious disease, once we start from our home, we wear a fresh pair of clothes, and once we reach to the hospital, we wear an N95 mask. We wear personal protection equipment, which include a gown from top to the toe, and we wear good quality gloves. Well, the quality of these PPE equipment should be of good quality, because we can't compromise on the quality of these kits. And once we work for 8 to 10 hours, we can't eat, we can't drink, and sometimes it's very difficult to answer the nature call. And once we doff this PPE kit, we change our clothes and take a bathe before we reach our family members. And we have to regularly get us checked as far as RT-PCR is concerned, and once in a while we definitely get our antigen tested also. And we don't go to our near ones, dear ones, and even mother, father whom are elderly, so that they don't get the disease from us. And another thing which is very important is that we follow the universal precautions and wear universal mask, social distancing, and wash our hands regularly. And another very important thing is that we do take chemoprophylaxis. Initially HCQS was recommended, and we did took it for initial 3 to 4 months, but then it came into disrepute, and now another drug known as ivermectin is being advocated to be used as a chemoprophylactic drug. And we do take this chemoprophylactic drug, especially among our family members do also take this, so that we don't get this contagious communicable disease.
I keep it simple but follow hygiene measures religiously, like frequently washing hands, respiratory etiquette like wearing face mask, keeping social distance from others, and also cleaning frequently touched articles and surfaces frequently.
What are the probable symptoms of COVID patients?
Well, if we talk of a symptom of the disease, this COVID is having varied presentation, and since it has come up in last December 2019, we are seeing various symptoms of this COVID, and it can present from any symptom from head to toe. But the common symptoms include cough, that is खांसी, is coryza, that is rhinorrhea, जुखाम होना, और इसके अलावा जो important symptoms है, आपको स्मेल का ना पता लगना, आपको टेस्ट का ना पता लगना, that is hyposmia or dysgeusia and anosmia. इसके अलावा जो आपको सिम्टम्स आते हैं सांस फूलना, और इसके अंदर पेशेंट की ऑक्सीजन है वो काफ़ी कम हो जाती है 94% तक, इट गोज लेस देन 94%, एंड वी रिक्वायर ऑक्सीजनेशन फॉर दिस। एंड इसके अलावा मलेज, बहुत ज़्यादा वीकनेस फील करना इज़ ऑल्सो अ कॉमन सिम्टम ऑफ कोविड। बिसाइड दिस इवन रैश इज़ रिपोर्टेड, हेडेक इज़ रिपोर्टेड, ब्लरिंग ऑफ विजन इज़ रिपोर्टेड, और आँखों का लाल होना इज़ रिपोर्टेड। सो वेरियस सिम्टम्स आर रिपोर्टेड, and if you see that a patient presenting to you with fever along with any abnormal symptoms, you definitely should get this RT-PCR for COVID checked, so that we can diagnose it early, because treating these patients, and the key to success is diagnosing these patients early, so that we can start treatment early. And there are few antiviral which are available right now, like favipiravir and remdesivir are available, which can be given in the early part of disease, so that the complication and mortality and morbidity is not there with COVID. Especially patients who are of diabetes, elderly, hypertension, chronic cancers, and patient with chronic kidney disease, patient with renal transplant, patient with bone marrow transplant, lung transplant, liver transplant, definitely need to be more cautious once they get this fever along with coryza and cough, so that it could be diagnosed at an early stage, and patient can be isolated and can be treated, so that we don't end up into mortality or morbidity with this COVID.
Most common symptoms of COVID-19 are sore throat, dry cough, fever, feeling tired. COVID-19 can also present as diarrhea, loss of smell or loss of taste, rashes over body, difficulty in breathing, chest pain, etc.
When should the alarm bells ring when we are observing self for COVID symptoms?
Well, if we talk of symptoms that should alarm ring in our head, it include desaturation, that is hypoxemia. That is, if we measure our oxygen saturation with the pulse oximeter, which should be present in our community, and if it is less than 94%, and if we do a 6-minute walk test, that is, if we walk for 6 minutes, and then if we check our oxygen, and if it is less than 94%, definitely it's an alarm bell which should be there in our head. Second symptoms is unusual weakness, unusual encephalopathy, that is behoshi in patients, and if a patient is of diabetes, hypertension, chronic kidney disease, lung cancer or any other cancer, or if he is a patient on transplant, or if the patient is on immunosuppressive drugs, definitely these patients, if require COVID, we have to be very careful, because the mortality is very high in these patients as compared to other general population. Second thing, if the patient is having age less than 10 years, or if the age is more than 60 years, again it's a difficult situation altogether, because mortality and morbidity is quite high in these type of patient. So first symptom is hypoxia, and second symptom is patient with comorbidities and of advanced age definitely need to be kept in our mind, that these patients are having more mortality and more morbidity as compared to other general population.
The red flag signs in COVID-19 are new confusion, difficulty in breathing, persistent chest pain, and high-grade fever.
How can we protect ourselves and our family members from this disease during winters?
As we all know that winter is approaching, and during this winter we tend to have more of viral illnesses because of the season itself, and as we have seen that the second wave which is coming in European countries and American countries, and there is a lockdown again being applied in the countries like Britain and Germany, and even American will be following this. So the second wave of this disease is coming, and there's quite of mortality and morbidity is occurring even in European countries. So we can definitely predict that if in this winter we will have these more of cases, and to protect us from this disease, we need to definitely follow universal mask usage, social distancing, repeatedly washing our hands, and not attending the family functions. We have to be aware that if we do attend these functions, we have more chance of getting this disease. So we have to follow the social distancing. We have to wear the mask. We have to wash our hand, and not to go in social gatherings, especially during this festive season of Diwali. We should avoid going to our friends or even our relatives, so that we avoid social gathering and avoid getting this disease, which could be very dreaded and can have more of mortality and morbidity, especially the patients with comorbid condition and elderly patients should avoid social gathering and should wear a mask and have social distancing and wash their hands regularly.
We can protect ourselves from COVID-19 by practicing respiratory and hand hygiene etiquettes, maintaining social distance, and boosting our immunity.
What has been your most important learning in COVID period, and has it changed your perspective towards lives and things in general?
Well, there is always two aspects of something which happens in our life, and COVID has come up in a big way, and it has changed our thinking, especially towards life. And as far as healthcare facilities is concerned, now we are more emphasizing on following universal precaution, which include N95 mask usage, social distancing, and washing our hands on regular basis. And once we reach our place or our home, we need to change our clothes and take a bath especially. Now, as far as public or as far as general perception toward life is concerned, that what we now say that life is unpredictable and anything can happen during our life. So COVID has taught us many things, and I pray to the God that it doesn't cause much of harm to at least our near and dear ones and to the society and India as a whole. So basically COVID should come now to an end, and as we have heard that a second wave is coming in countries like Europe and America, so this second wave shouldn't come in our country, so that we remain healthy and peaceful. To avoid this second wave, we have to follow the religious guidelines of mask usage, social distancing, and washing of our hand regular basis पे. और जो हमारी अभी कल्चरल एक्टिविटीज़ हैं, especially during this Diwali festive season, we should curtail those, and one shouldn't make too much of social gathering. Thank you, dear friends, and stay safe, stay healthy.
We have a huge responsibility towards our society. Each and every one of us counts. We can and we will sail through these difficult times. This pandemic has brought the people of all ages and from all walks of life together to work against this pandemic as one.
Dr. Major Priyanka ma'am, why did you opt to become an army doctor?
I was always fascinated with the army. It is such a proud feeling to serve for the country being in the army. I can be a doctor and an army officer both at once.
I am sure that your inspirational words will motivate the students to work hard and achieve their targets of getting admission to medical colleges, the first stepping stone on the path of service of humanity.
Thank you, Dr. Sandeep sir and Dr. Major Priyanka ma'am. We are extremely grateful that you have shared your views with us. As a mark of appreciation for your work and dedication towards your profession, we present to you a bouquet of flowers and a certificate of appreciation from all of us at APS Meerut Cant.
Once again, on behalf of all of us at APS Meerut, we thank you for guiding us, and I'm sure that it has been a great learning experience for all our viewers. The Karamveers, the people whose actions speak volumes and make life easy for people.